a group of parents who give of their time and their expertise in different ways through the hospital. So they might do presentations, they might sit on interview panels, they might help design information or space design. So we have this network of volunteers, patient family advisors who assist in the work we do. So they're familiar with our team, they know us quite well. And when the pandemic hit, they started contacting people from our team, reaching out to say, I'm struggling. I don't know what to do. Do other people not know what to do? How do we collectively come up with some solutions? Or can I learn from other people? How do we do this? So, from that point, from those phone calls that came in, a focus group was set up to really sit with a group of people and talk about this and say, what's going on in your lives? What would help with this? How do we do this? And that's where the idea of the caregiver sessions was born.
Like, it was mid-March when the entire nation was told to go home and stay there and don't let people who don't live in your house in. And for a family like Jacob and I, who have a member, like Jacob's medically complex, and we have a team of caregivers that help me live here at home with him, none of them live with us. So it was very difficult to make decisions on my own about who and how and when somebody could come in and support us and still be safe. And within a couple of weeks of not having barely any help, I was experiencing some mental health concerns. Lack of sleep was a big thing, and like serious lack of sleep. I was sleeping 3 days a week for about 10 hours. That's where this stemmed from, was the response to that reaching out. So within a week, I got an invite to a focus group held by the Patient Family Centered Care team. And myself got an invite, as well as some other families, the parents of other kids that are medically complex. There was quite a group of us, and we talked about what would be helpful to us right now, when nobody can really do anything in person. And the focus group kind of came up with an opportunity to speak to others in the same situation and just lessen the isolation would be a great start.
Everything that we do with this group is passed through, if you think of it as a sieve, passed through the sieve of those guiding families to say, yes, this matters. If there's not a good, strong, heartfelt yes, it's not something we do. This is providing families who can't easily find a peer group in the community because maybe they're only one in the province. A peer group, so that they also get the chance to parent with support. So much about healthcare is hard, and to do it alone, it raises the risk of stress. It raises the risk of mental health difficulties. I can only calm myself so much, but bring another brain next to me, and that's what a support group is. Now you're holding me, and I'm holding you, and through that community, our stress levels drop. And there's this wonderful theory called it's the polyvagal system of stress that shows that what we really want to do first when there's a problem, we don't want to go into fight or flight. We don't want to run away from it or try to kind of knock it down to the ground and work it out. What we really want to do is turn to somebody else and problem solve together.
The tricky thing is when you have a child with a lot of medical issues, a lot of people don't want to share their worries with you. You know, they think that it's overburdening you, or they think the most common thing is, well, I know you already have so many worries. When I first heard about the caregiver sessions, I kind of thought, oh, I need to get in on this. I don't know where I can fit it in, but I need to get in on this. You know, like I'm not sure how I can manage the extra, another video meeting, but I need a chance to be able to talk to my peers, and to have somebody there who could, maybe facilitate a bit.
with my role as a facilitator, part of that is how do I make it easier for people to actually talk? We don't want to check in to sort of take the full session time, because then it's just like we all took turns talking. The real meat of the group is actually when we have a conversation with one another. I'll ask people to share what's their go-to when life is really hard. What's your go-to to feel a little bit better for even 5 minutes? Because that's the kind of information that helps all of us.
This was the first time I've done a virtual peer group session. And the format actually worked really, really well, especially with COVID. It allowed it to continue uninterrupted. I think the biggest transition was probably more for the providers or the hosts of it, transitioning from them being in the office to doing this from home. It's also a really flexible way to attend. I can attend both with video or just calling in with audio. So depending on the circumstances of my day at that time that we're meeting, that it's easy. It makes it really easy to call in and participate.
I need this group to keep going because my mental health doesn't depend solely on this, but it's a very big player in my recovery and my ability to function moving forward. I'm sure I'm not the only mother in this country that could say that how the pandemic manifested in my life has been one of the most trying experiences of my life. I'm doing a lot better and I'm very grateful for that. And part of the reason why is because I have a tribe of medically complex families that I have bonded with, and we meet regularly to discuss what's going on for us and support each other and listen and share and laugh at the ridiculousness and cry about our trials. It's quite a bonding experience. It's quite a bonding experience.
There's just this constant support and learning, and they learn from each other as much as they learn from Adrian, from Michelle and I. We're just we're there for them to provide them with this forum. And the beautiful part is seeing the way they do that for each other and the way they gain strength from that to cope with life in this very uncertain time. It's not a really daunting thing to create. It's something that people can access without much difficulty. I hope that it spreads. I hope that it becomes something that can be offered more broadly to other people and to families everywhere who are going through medical crises.
Quality care means taking whatever that happened in that healthcare piece and making it as a positive experience as possible to get the best possible outcomes. Having me in a place with a really excellent support group of peers means I can do a better job of supporting and as a parent, leading that care that my family is getting.